Senator Tom Harkin saying the Democrats have the votes for the public option, even if it is not in the Senate bill. Frank Luntz says that these guys in Washington are not listening to what Americans really want, which, by the way, is the title of his new book. It is a phenomenal book where it really puts in perspective you. First time an author's done that in a while. So you're thinking that these guys are whistling past the graveyard here. They're not getting it.
They're not getting it because we don't want to be treated like a number. We don't want to be identified by our Social Security number. We want to be treated like human beings. And we also don't want ideology to play a role in healthcare reform. We want healthcare to be patient-centered. We don't want a government takeover. And most importantly, we don't want a delayed care, and we don't want care that gets denied. We don't have to wait forever for treatment or for even the test for those treatments. And we've been testing ads to see how the public responds. All
right, this big government spending one, we talked to folks on this. Let's take a peek at this.
Working families continue to bail out Wall Street banks. We pay mortgages for those who borrowed too much. We own General Motors. The federal deficit tripled in just 1 year. Where does it end? Now some want Washington to take over health care. Government insurance means exploding taxpayer costs. There is a better way to health reform, with patients and doctors in charge, not government and insurance companies. Tell Harry Reid we can't afford government-run health care.
Pretty powerful stuff.
That is powerful. The lines, the Republicans and Democrats, if the ad goes above a 50, it's good. If it goes above a 60, it's a home run. That ad was the single best ad among Republicans of any that we've tested, and the second best ad among Democrats. Why? Because they see the spending, they see the cost. Neil, there's one simple question that the American people ask. How can you spend $1 trillion and claim that it's deficit neutral? It's impossible.
But it's interesting that it's getting back to something supposedly we had gotten over in the last election, and that is this fear of big government. Apparently we're back to fearing it.
What Americans really want, is an elected official who will look at us straight in the eye and say what he means and mean what he says. And we don't want politicians messing with health care. There's another ad that you've got back there of a female doctor, an incredible communication, because it comes right from the medical profession itself.
Let's take a look.
Washington already controls Medicare, and Medicare will be bankrupt in 8 years. Despite this looming bankruptcy, some want to pay for health care reform with $500 billion in Medicare spending cuts. And look at Canada and England, where government controls health care. Patients wait up to a year for vital surgeries, delays that can be deadly. So instead of forcing Americans into the kind of health care system that has already failed, Washington needs to fix Medicare first.
Learn more at AmericanFutureFund.gov.
Government should never come between your family and your doctor.
So you have these monitors hooked up to Democrats and Republicans. They're not being electrocuted, are they, when this is happening?
No, it's a very painless process. They turn it up and down.
And they like that ad.
They love that ad. Larry McCarthy is the media consultant who produced it. It's perfection. Number one, it's a real medical professional. Number two, it's a female who we believe has more compassion to these issues. Number three, there's not an ounce of politics, partisanship whatsoever. Number four, she talks about protecting Medicare. And number five, the language that she uses about the sacred doctor-patient relationship is exactly what Americans want most when it comes to health care.
All right, but Americans, when you hear the reports, Frank, that we like our coverage now, we can talk about it. The president's been saying, well, you might like it now, but you won't like it very long. Does that register on people, or is it this stuff that's registered?
This registers because actually people ask, well, if we change health care, who guarantees that I can actually continue to choose the plan, the doctor, the hospital? Because we know that employers could say, okay.
So no matter how much a politician tries to assure them to the contrary, you're saying they're like from Missouri, they're not buying it.
What the American people want is to cover those 30 million who aren't covered and don't mess up the health care system in the process of doing it. They do believe that everyone should have health care, but don't wreck my health care in providing it to those 30 million people.
Amazing stuff. Frank Luntz, always good seeing you, my friend. That's the book. That's the one you want to get because he's finally talking about us, not politicians, what Americans really want, what you really want. It's a must read. I don't care where you are in the political spectrum. All right, I'm going to see you 1 hour from now on Fox Business.